Hi, my name is Jess Burke, and I'm an Associate Director at CIJA as well as our LGBTQ2+ Partnerships Liaison. We are so pleased to be offering an event in celebration of all of the fantastic work that Vancouver Pride does. In a demonstration of allyship, in order to ensure that queer and trans Jewish folks feel celebrated, honored, and supported by the community, CIJA has been participating in the Sunset Beach Festival and attending the Vancouver Pride Parade since 2013. And alongside community partners, CIJA has been hosting a robust Pride Shabbat dinner annually since 2017. Equally, CIJA's LGBTQ2+ National Advisory Council has had representation from Vancouver, British Columbia since its inauguration in 2016. What started as a modest and intimate Pride Shabbat potluck in the park has grown to a very enormous dinner of over 120 members, where people can come and celebrate their queer Jewish children, their congregation members, and their community. But more importantly, this is a space where queer and trans Jews, like myself, can show up and be our full, entire selves. Ensuring that queer-led and designated spaces, including Pride movements, are friendly, inclusive, and safe for folks from the queer and trans Jewish experience is extremely important. It really does take a village, and this amazing event wouldn't have been possible without the generous support of our community partners. It's my pleasure to thank the Jewish Federation of Greater Vancouver, CJ PAC, Congregation Beth Israel, Temple Shalom, or Shalom Synagogue, the National Council of Jewish Women Canada's Vancouver chapter, the Canadian Associates of Ben Gurion University, Hillel BC, the Jewish Museum and Archives of BC, Jewish Family Services, Vancouver Talmud Torah, Louis Breyer, King David High School, and the Richmond Jewish Day School. Without further ado, it's my pleasure to introduce David Friedland and Noah Faraj, our two LGBTQ2+ National Advisory Council members representing Vancouver, British Columbia.
My name is David Friedland. My pronouns are he, him, and I've been a member of the CIJA LGBTQ2+ National Advisory Council for 4 years now, and I've previously represented Edmonton and Calgary, Alberta, and now I'm located in Vancouver, British Columbia.
My name is Noah Faraj. My pronouns are she and her. And this year I joined the CIJA LGBTQ Advisory as a representative for here in Vancouver. It is our distinct pleasure to introduce this afternoon's speaker, Dr. Alex Abramovich.
Dr. Alex Abramovich has been addressing the issue of LGBTQ2S youth homelessness for close to 15 years now. He's an award-winning, internationally recognized leader in the area and is one of only a few Canadian researchers studying this very important issue. His program of research focuses on preventing, reducing, and ending LGBTQ2S youth homelessness in Canada and addresses issues regarding transgender health, including health service use, health outcomes, and transgender inclusive health care.
Dr. Abramovich is an independent scientist at the Institute for Mental Health Policy Research at the Center for Addiction and Mental Health and an assistant professor at the Dalla School of Public Health at the University of Toronto. His research has led to groundbreaking practice and policy reform, including the launch of Canada's first dedicated transitional housing program for LGBTQ2S youth, and he has worked closely with all levels of government to develop policies and strategies that address the needs of LGBTQ2+ youth and young adults experiencing homelessness, and is committed to research that successfully and ethically engages marginalized populations.
Welcome, Dr. Abramovich.
I'm a research scientist at the Center for Addiction and Mental Health in Toronto. I'm also an assistant professor at the Dalla School of Public Health at the University of Toronto. I've been addressing the issue of LGBTQ2S youth homelessness for nearly 15 years now. My program of research focuses on transgender health and LGBTQ2S youth homelessness and understanding their unique experiences, needs, and challenges, with the overarching goal of providing practice and policy recommendations to prevent, reduce, and ultimately end LGBTQ2S youth homelessness across Canada. As a qualitative, community-based researcher, I work closely with the young people affected most by these issues and key stakeholders and community agencies to create action and positive social change. My presentation today is going to focus on LGBTQ2S youth homelessness in Canada And I'm also going to share a little bit about my own story and why I do the work that I do and why it's so meaningful to me. I'm going to start off with a little bit of my own story, which hasn't been easy for me to share, but it's a question that I get asked often, which I usually just brush off. But I think it's an important story to share because it's what led me to the work that I do today, and it helps contextualize the lens from which I approach my work. I also think it's an important story to share because as someone who has spent a lot of time working with young people and interviewing them and asking them personal questions about their lives and their experiences, I should be able to answer the questions that I ask, which I believe is an important exercise for us to all do. Coming out is hard. Coming out is hard for everyone. There is no way of knowing how people are going to respond. There's also no way of knowing who or what you might lose. Some of us lose our families, our homes, and our communities when we come out. I came out as a lesbian when I was 21 years old. It was the day after the Toronto Pride Parade, and I'll never forget that day. It was the day that my heart broke for the first time, and the day that I lost a little bit of my faith in humanity and stopped feeling safe in this world. My family had a really hard time with my coming out. In fact, they didn't take it very well at all. It changed my life in significant ways, and it shifted the way that I saw the world. I was living with my parents and my brother at the time in a very straight Jewish suburban neighborhood just north of Toronto. There weren't any programs or services to support LGBTQ youth, let alone LGBTQ youth who were dealing with family conflict or who had been kicked out of the house. I felt hopeless and trapped, and I started to believe that there was something wrong with me because of who I was. Such a terrible feeling for a young person to experience when they're just starting to figure out who they are and are just learning how to live authentically. I remember feeling very alone and desperate for support. When I finally built up the courage to ask for help from an LGBTQ center at York University, which is where I was an undergraduate student at the time, I was told that they would only be able to help me if I was staying at a shelter. For me, that was the first time that I began to really understand just how fragmented the system really is and how little support there was for young people in my situation, especially for those who were living outside of Toronto. But it was through my own personal coming out experience that I came to learn that a house does not necessarily mean a home. I also learned how easy it is to become homeless when you're a young queer or trans person who's coming out to an unsupportive family. It was my family's response to my coming out that made me devote my life's work to better understanding issues regarding LGBTQ2S youth homelessness and wanting to create a world where no young person has to know what it feels like to not have a home because of their gender identity or their sexual orientation. I didn't have anyone to turn to for support when I came out, which made me feel incredibly alone and rejected. My coming out experience made me realize just how strong the connection between coming out and homelessness is, and it provided me with a deeper understanding of the work that I do today. I feel extremely fortunate that I've been able to use my lived experience to help those in similar and worse circumstances and create a program of research devoted to better understanding these problems and developing a prevention plan. Being able to relate to my work on such a profound level has not only taught me how to nurture the voice of the personal, but it has also allowed me to connect with the young people that I work with in a more reflective and meaningful manner. No young person should ever be rejected because of how they identify or who they are attracted to, especially not by the people who are supposed to love them unconditionally. I was lucky because my parents loved me and they eventually learned to accept me for who I was, but not everyone is so lucky, as I'm sure many of you know. Identity-based family conflict resulting from a young person coming out as LGBTQ2S is a major contributing factor to youth homelessness and is really the most frequently cited reason that queer and trans youth experience homelessness. As many as up to 40% of young people experiencing homelessness across Canada identify as LGBTQ2S. LGBTQ2S youth tend to become homeless at younger ages and experience homelessness for longer episodes compared to cisgender and heterosexual youth. leading to many serious issues. Some LGBTQ2S youth are more likely to experience homelessness and poverty than others. For example, Indigenous queer and trans youth and racialized queer and trans youth experience homelessness at disproportionate rates. These numbers might be higher or lower in some communities across the country. We still don't know for sure because we really haven't been collecting the data up until fairly recently. And even when we do collect inclusive data, many youth are missed because they don't access services due to safety concerns, so they don't even have a chance to complete the surveys. This is not a big city problem. LGBTQ2S youth exist everywhere in rural and urban communities across the country. It is unfathomable that in 2020, we continue to have an unaddressed LGBTQ2S youth homelessness crisis across Canada. Although Canada is often considered one of the safest countries for LGBTQ2S people, still widespread homophobia, transphobia, and biphobia are an everyday reality for many, resulting in situations where queer and trans youth do not feel safe accessing services that are supposed to provide support to all young people. One of the biggest issues that LGBTQ2S youth face in shelters and housing programs and institutions more broadly are issues regarding safety. I can't tell you how many young people have told me that they do not feel safe and are regularly forced to choose between unsafe situations, especially trans people of color who navigate systems with multiple marginalized identities. For example, they may have to decide between sleeping somewhere that they know is not going to be safe, but where they could identify however they want, and some place that they might be safer physically, but will likely be discriminated against based on their identity. And others who have had to make the difficult decision to sleep in a park or an alleyway where they knew that they would have to be alert all night rather than in a shelter where they would have access to a bed, a warm shower, and a hot meal. But they will likely be discriminated against based on their gender identity or sexual orientation. And their identity would not be respected because not all shelters and housing programs operate in the same way. So it's difficult to know how workers may respond to a young person. Many of the systems that we currently have in place that are meant to support all young people are often not constructed for or trained appropriately to meet the specific needs of LGBTQ2S youth who have experienced multiple stigmas related to racism, transphobia, and homophobia. Discrimination and social stigma have very serious consequences on the health and well-being of LGBTQ2S youth, leading to significant mental health issues, substance use, anxiety, depression, and suicide. I'd like to share a quote with you, which is a very common narrative that I've heard from LGBTQ2S youth over the years when talking about access to shelters. Almost all LGBTQ people going into shelters have a fear of them because it isn't a matter of if it's dangerous, but just how dangerous it will be. It is horrible to live in that fear every day. I recently conducted a study focused on LGBTQ2S youth homelessness in New York region. I wanted to focus on New York region because there's limited research on suburban and rural youth homelessness in Canada. But we know that there are unique challenges and barriers associated with youth homelessness in smaller towns and rural settings. We also know that hidden homelessness is a significant issue among queer and trans youth living in rural communities, making it difficult to accurately determine the scale of the problem. Rural and suburban communities tend to have fewer specialized services and resources available to youth experiencing homelessness. Support services also tend to be less accessible to youth in these communities since they're often centralized in urban settings. For this project, my team and I used CAMH's mobile research lab to recruit and interview youth across York region. The mobile research lab is a really great tool. It allows us to collect data in communities that may not have as many services, such as rural and remote communities. This study was meant to provide really like a snapshot of the experiences and challenges and needs of LGBTQ2S youth who are at risk of and experiencing homelessness in York Region. There were 42 participants who took part in the study, including 33 youth between 13 and 26 years old, who participated in one-on-one interviews, and they also completed surveys. The surveys were focused on mental health and support and family connectedness. There were about approximately 10 key informants also who participated, and these were frontline staff and management from youth services across York Region, and they participated in one-on-one interviews. We also created a youth advisory committee and a community advisory committee. We created these committees at the beginning of the project, and we met with them twice throughout the course of the project. As a community-based, action-oriented researcher, this is common practice for me to create advisory committees for each of my projects. So throughout this project, we discovered that family conflict, including identity-based family rejection, was really the most common pathway to homelessness, which was no surprise. Other factors included abuse, mental health issues, and problematic alcohol use. One young person who was 16 years old, she was living at home at the time, so she classified herself as someone who was at risk of homelessness because she had previously been couch surfing because her home was not a safe place. This is how she described her situation with regards to family conflict. She said, my mom, said that I make her sick to her stomach and that she wants to throw up because of me. And I put her under so much stress and that she wants to kill herself because of me. It was heartbreaking and I didn't feel safe at home, so that's when I left. I'm sharing this quote because it really illustrates just how the severity of the situation for so many of the young people who really have nowhere else to go and are stuck at home and are forced to stay in unsafe situations. The average age that the participants first left home was 18 years old, and almost 30% of participants reported that they first left home at the age of 16 or younger. This is important to note because youth who leave home earlier have been found to experience more difficulties in the long run and also experience multiple episodes of homelessness. Previous studies have reported that LGBTQ2S youth tend to experience homelessness at younger ages, but it has been quite challenging to recruit the younger LGBTQ2S youth. That's something that I have found in my previous research studies, just that it's already a very hard to reach population, and so when you're trying to recruit youth who are younger, that tends to be even more difficult. And perhaps it may be because those youth are oftentimes perhaps still at home, as was the person who I just shared the quote from. A difference in this study and previous studies that I've been involved in is just the age, as I'm talking about here, just the age of the youth. So the average age of youth for this study was 18, whereas in many other studies, youth tend to be in their early to mid-20s. Despite the high rates of family conflict and estranged family relationships, many young people had regular contact with at least one family member. 68% reported that family contact is important, and 80% reported that they would like to improve their relationship with a family member. I think that really speaks to just how resilient LGBTQ youth are. Youth experiencing homelessness commonly have prior involvement with child protection services. That's something that we have found in many studies with regards to youth homelessness. Difficult transitions from child protection services, including aging out of the system, is often a common pathway to homelessness. Consistent with findings from other research, over half of the youth interviewed for this project reported that they had previous involvement with child protection services, particularly Children's Aid, or CAS in this case. For some of the youth, their involvement with child protection services began at birth or early in their lives when they were taken into foster care or group homes, while for others, their involvement was limited to one conversation or occasional check-ins with CAS. There were also a number of youth who reported that they wished that CAS had gotten involved with their families. Another important finding was that the majority of youth experienced food insecurity in some form, and this was often due to monetary issues. So for example, over 50% of the youth reported that they had experienced hunger due to not having enough money to buy food 2 to 3 times a month. And almost 40% reported that they had experienced hunger at least once a week. Youth reported a wide range of experiences with regards to LGBTQ2S identity, disclosure, and non-disclosure. Some youth reported feeling that they have to hide their identity, and they were fearful of people finding out that they identify as LGBTQ2S due to discrimination, violence, stigma, and being treated differently. One young person spoke about feeling more comfortable and at ease telling people about his heroin addiction compared to coming out as gay. And this is what he said. I'm more comfortable telling people about my heroin addiction than I am telling people I'm gay, because you don't get the same reactions. One of my close friends actually tried to cut my throat when I told him I was gay. I've been in a few shady situations in my life where I've been stabbed, I've been shot, and I've been lit on fire. I've experienced people lashing out so badly to the point where I'm very careful with who I tell. Many youth spoke about LGBTQ2S identity non-disclosure at shelters, health clinics, and schools due to previous experiences of overt and covert homophobic and transphobic discrimination. Youth reported microaggressions, willful ignorance, and marginalization. While some youth described feeling unsafe disclosing their LGBTQ identity at youth-serving organizations and shelters, other youth said that they feel safe and they feel supported by staff at shelters, at school, and by friends and family. So that just goes to show how, there's not really one experience for all youth, obviously. And so in this case, some youth felt safe while others didn't feel safe. So, people really have different experiences accessing services and institutions. Many of the youth reported feeling safer disclosing their LGBTQ2S identity at shelters and programs where there are staff who are out as LGBTQ2S. And that was something that I really found across the board, that if there were queer and trans staff at services, youth generally felt safer, coming out as well. Some youth spoke about gay-straight alliances, or GSAs, at their schools, which really helped them create a more supportive and inclusive environment, and just made them feel more included in the school environment. The majority of youth reported that they had been threatened with violence or verbally insulted or abused. Almost half of the youth reported that they had been hit, beaten, physically attacked, or sexually assaulted because of their LGBTQ2S identity. Many youth expressed having poor physical and mental health and a variety of health conditions. The majority of youth were struggling with depression and anxiety and panic attacks. For example, 65% reported severe anxiety, and 61% had been diagnosed with depression. Youth expressed issues regarding feeling lonely, fearful, nervous, and worried about the future. And these issues regarding mental health are often due to stigma, discrimination, and oppression. And I think that's very important to note, because sometimes people think that that LGBTQ2S individuals experience higher rates of mental health because of their identity, which certainly isn't the case. It's because of society's response and because of ongoing stigma. Many youth reported that their mental health and or alcohol and substance use was interfering with their lives in some capacity. 77% of youth had reported that they had overdosed or had alcohol poisoning in the past year, and they expressed concern about overdosing. There was a high suspicion of alcoholism in almost 60% of youth. and close to 50% of youth felt that they ought to cut down on drinking or substance use. One youth shared, this is a quote from youth, "I have a lot of my own personal struggles. I'm not very open with the fact that I'm gay. But on top of that, I'm a recovering addict. I used to be heavily addicted to heroin. Being in a space like I'm in, where drugs and alcohol are so predominant, it's hard to refrain." Self-harm and suicide were also major concerns for youth. Over the past year, almost 40% of youth had attempted suicide. 81% thought that they would be better off dead, and almost 50% had made plans to attempt suicide. 81% of youth reported that they had thoughts about hurting themselves, and 74% reported that they had self-harmed without the intention of suicide. Unfortunately, this was not surprising. These are issues that have come up in previous research as well. Something that we have found is that LGBTQ youth who come from families that reject them are 8 times more likely to attempt suicide than those who receive familial support. The suicide rate amongst transgender people is considerably higher compared to the general population. For example, the Trans Pulse study was an Ontario-based study that investigated the health needs of trans people across Ontario. And they reported that 77% of trans people in Ontario had seriously considered suicide, and that 43% had attempted suicide. Trans youth were found to be at the greatest risk of suicidality. But it was also found that with strong parental support, the risk of suicide decreases by 93%. So there are very clear health benefits experienced by trans youth with supportive relationships and by those who could live safely in their authentic gender. Supportive families and safe and supportive environments are critical to the health and well-being of not only trans youth, but LGBTQ2S youth more broadly. Unfortunately, not all LGBTQ2S youth receive support from their families of origin, and the consequences of family rejection can have a lasting negative impact on youth. Over the years, I've learned that even the most resistant people can change, including people with the authority to implement real-world change, as well as organizations that have historically been homophobic and transphobic. People's attitudes and thinking can shift, but sometimes we need to provide people with the right tools to better understand certain complex issues. My parents, for example, they just needed time, and they needed tools to learn how to better support and understand me. But what is key is that they never stopped loving me. My family had a strong foundation of love, and this made things easier between us when I came out again almost 10 years later as a trans man. My family was much more understanding the second time around, but it was still quite difficult for them. Unfortunately, I was faced with a whole new set of challenges, not only from my family, but in my everyday life. I had just started my PhD. My educational and professional journey has been filled with many difficult challenges over the years, because I've encountered people who were in positions of power who were not prepared to work with a diverse group of people, and who made assumptions that placed me into categories that I did not belong in, which created many barriers for me. I've learned that coming out is an ongoing process that occurs almost daily, because our heteronormative and cisnormative culture is designed in such a way that it forces people to continuously come out, or rather to have to continuously come out. Having to constantly come out and explain who you are so that people address you correctly is extremely exhausting, as I'm sure many of you know. And it eventually impacts your mental health and your mood, and the way that you interact with others, regardless of where you're living or whether or not you're experiencing homelessness. When you don't see yourself reflected in the services that you access, when you don't have anybody to relate to, no role models who are remotely close to who you are, when your identity is never listed on the forms that you're asked to fill out, but rather the closest option, the only option, is other. You're forced to always check off other. When you can't even find a bathroom to use because the bathrooms that are available are designated for 2 groups of people, and you do not fit into either group. When every space that you enter and every form that you fill out tells you that you do not exist, then you begin to feel like you do not belong, and it can seriously impact how you see yourself. Something important that I've learned through my own personal experiences and through working with LGBTQ2S youth is that so many aspects of daily living have been designed for a certain type of person. And if you're not able to fit neatly into society's categories, then there's no doubt that you will face consequences. You will be stared at, rejected, stigmatized, and ultimately erased and made invisible by institutions and government policies. And this starts very early in life, really from the moment that we're born. Being a young person is scary, regardless of your sexual orientation or your gender identity. Being a young person who doesn't fit in is terrifying because our culture pathologizes almost every emotion and behavior that human beings are capable of feeling and expressing. The extreme pathologization of gender makes it even more difficult for people to come out and bring their full, authentic selves to programs and support services. Young people need positive role models that they could look up to. LGBTQ2S youth need people to look up to that can inspire them to be their full, authentic selves, especially in a world that often makes them feel like their existence is not important and that their needs cannot be met. In many ways, homophobia and transphobia have come to be socially acceptable because many of us are conditioned to believe that it is wrong to be anything but heterosexual and cisgender. The normalization of homophobia and transphobia are also well entrenched in our society's response to homelessness and the institutional culture of many shelters and housing programs. There are a variety of solutions to these issues, which is great. It's great to know that these are a lot of problems that I'm talking about and highlighting, but there are also solutions. Some of the solutions are easier to implement, while others take more time and more resources. On the screen here, I've outlined some of these solutions. A standardized model of care is absolutely necessary in creating accepting, affirming, and supportive environments for youth. It also allows youth to know what to expect when they access services, because then services use the same forms at intake. Forms that actually include basic questions such as, what name do you go by? Unfortunately, these types of questions aren't always included on institutional forms, especially at shelters. And some shelters might include those questions, but it often depends on who is working on what day, whether or not they're going to ask those questions. Our name is such a fundamental part of our identity. And I think it's safe to say that most of us expect to be called by our name, or at least the name that we introduce ourselves with. I'm sure that we can all imagine what it would feel like to constantly be referred to by the wrong name and the wrong pronoun. Unfortunately, most, if not all, trans people know what it feels like to be erased and made invisible in subtle and obvious ways by family, friends, and organizations that refuse to recognize who we are. A recent study reported better mental health, including lower risk of depression and suicide among trans people addressed by their chosen name at work, school, and home. Staff at programs should also receive similar training so that we are all on the same page. There needs to be close consideration to the physical environment of shelters. For example, we know that private and semi-private rooms with washrooms increase access by improving safety, as well as making sure that bathrooms that can accommodate all identities are available at shelters and housing programs. And sometimes this is really simple. Sometimes it's as simple as replacing a gendered sign on a single stall bathroom with a sign that reads all gender. It's really about ensuring that youth see themselves reflected in all aspects of a program, and that programs operate from a similar framework so that youth can spend less time worrying about whether or not a program or organization is inclusive. This screen shares some of the recommendations that I made as a result of the York Region study. These recommendations are really meant to help service providers address these issues and ensure safety for all youth. In addition to a standardized service delivery model and holding all services accountable, it is also important to provide population-based services, particularly for marginalized populations such as LGBTQ2S youth. This involves supporting the delivery of specialized housing programs, as well as drop-in services and mental health supports, such as helplines, virtual services, and in-person services. It really comes down to having options. People need options and the ability to select the option that works best for them, because a one-size-fits-all approach does not work. An example of an inclusive population-based housing program is YMCA Sprott House, which is Canada's first transitional housing program for LGBTQ2S youth. YMCA Sprott House opened in January 2016 in Toronto, and Sprott House is a 25-bed facility. It's a transitional housing program specifically for LGBTQ2S youth between 16 and 24 years old, and they can live at Sprott House for up to 2 years. Like many transitional housing programs, they offer a wide variety of programs that are meant to support youth in a number of ways. But a major difference between Sprott House and many other programs is that all of their programs have been designed through an LGBTQ2S lens, with the needs of LGBTQ2S youth at the center of all aspects of the housing program. There are also, many of the staff also identify as queer or trans, and they are, they're open about their identity, and they're out to many of the youth who live at the program, which makes a very big difference for youth. I worked closely with the City of Toronto and with YMCA Sprott House in the opening of this service, and then I evaluated the program during their first year of operation. So essentially what I did was I interviewed all of the youth as they moved into the program. They completed a set of standardized surveys focused on mental health, and then they were interviewed again a year later when they moved out, and they completed the surveys again at that point in time. And I say a year later because during the first year, the program was really meant just for 1 year. And through this evaluation, we discovered that youth needed more time in many cases, which is why the program was extended to 2 years. So the majority of youth spoke about feeling a sense of belonging and acceptance that they had never felt before. And they described Sprott House as the first place that they were able to just be themselves without having to fear for their safety. I also found that youth experienced decreased unemployment, increased school enrollment. So many of the youth who were unemployed during the first interview had secured a job by the second interview, as well as school enrollment. Many of the youth also reported mental health needs, unfortunately, that were not being met. And this was because they did not have a family physician due to negative previous experiences. I find that when it comes to issues experienced by LGBTQ2S individuals, people often wait until something tragic has happened before responding. So the response always ends up being reactionary, rather than thinking about prevention and ways to avoid tragedies from happening in the first place. It is not enough to put up rainbow flags and celebrate Pride once a year, or to say that you're doing the best that you can do. By making a commitment to prioritize LGBTQ2S youth, we can create inclusive environments in support services and housing programs where youth can bring their full, authentic selves and learn to celebrate who they are. And when government policies and plans to end homelessness prioritize disproportionately represented populations, including LGBTQ2S youth and Indigenous youth, they create life-saving policies. Because these are the kinds of things that save lives. And these are the kinds of things that allow us to build a foundation of hope for young people who may otherwise feel hopeless. Although my personal and professional journey has been a difficult path to travel because of my identity, coming out and being myself is literally the best thing that has ever happened to me. Not only did it lead me to a career that I'm extremely passionate about, but being able to live authentically allowed me to fall in love and start a family, which I'm endlessly grateful for. My wish is for every young person to be able to be safe and supported while living authentically without losing their home and their family. I believe that every person deserves this. If you're interested in learning more about LGBTQ2S youth homelessness or more about my research and programs that I've described throughout this presentation, you can download this book, Where Am I Going to Go? Intersectional Approaches to Ending LGBTQ2S Youth Homelessness in Canada and the US, which is a book that I co-edited with a colleague of mine from the US. In this book, there are 53 contributors in 11 chapters, which include research and case studies demonstrating innovative practices that are currently taking place to address queer and trans youth homelessness in Canada and the US, and the voices of LGBTQ2S youth and young adults from Canada and the US. And we'll provide a link where you could download this book for free. Thank you.
My name is Jonathan Lerner, he, him, and I am a member of CIJA's LGBTQ+ National Advisory Council, representing Nanaimo and BC beyond the Greater Vancouver area. I would like to thank both Dr. Abramovich and CAMH, the Center for Addiction and Mental Health, for this meaningful presentation on ending LGBTQ2S youth homelessness here in Canada, as well as deep thanks for sharing his own personal story. To access a free copy of Dr. Alex Abramovich and Jama Shelton's book, Where Am I Going to Go? Please visit this link. Thank you.